Hello everyone, myself Dr. Prateek. So let's discuss about diseases of external ear. There are some congenital deformities present in the baby. So first one is anosia. By the name itself suggests N means absent, ossia means pinna. So it's an absent pinna. As you can see, the baby is not having any of the pinna. Okay. Then again, other term is microtia. That means malformed ear, or we can say smaller ear, where the pinna is not of normal size but of smaller abnormal size. Another term, bat ear. We all know bat. So how the bat ear looks? So in the bat there is no antihelix. So bat ear absent antihelix. Look at the diagram. Normally in our ear there is an antihelix. So antihelix should go like this. Okay. So this is our normal ear. So in bat ear there is antihelix absent. Then comes Mozart ear. So in Mozart ear what happened? There is fusion of antihelix plus helix. So Mozart ear is fusion of antihelix plus helix. Then other term is Wildermuth ear. So Wildermuth ear there is absent helix. These are some of the congenital, or we can say post-birth abnormalities. Now there is preauricular appendages. So what is preauricular appendages? In the area which is anterior to the auricle. So in the preauricular area, some of the times there is presence of some skin tags or some sort of tissue. So look at this diagram. So this is preauricular appendages. So it is present in the preauricular area, as you can see here. Okay. Now there is preauricular sinus. Look at the diagram. There is a small opening present just anterior to the pinna, which is known as preauricular sinus, and it is present at the anterior most part of the pinna, which is at the junction of the tragus. This is my tragus and this is my helix. So in between the anterior end of the helix and the tragus, there is a small opening which is known as preauricular sinus. It is present at the root of the helix. And why this happens? Because of incomplete fusion of structures which are being produced by the first and the second branchial arch. So during embryonic life, the formation of pinna, it happens because of the fusion of first and second branchial arch. And sometimes if there is incomplete fusion, that will lead to preauricular sinus. What is the treatment of preauricular sinus? The treatment is surgical excision. So we just don't have to excise only the upper end. We have to locate or dissect the complete bag which is being located inside this sinus. Sinus is only an opening. Beneath that there is a big bag. Sometimes in that bag pus or some sort of debris or some sort of mucus collection will be there. So we have to just surgically excise complete sinus along with its bag. Now there is another term which is known as cauliflower ear. So cauliflower ear, it is generally because of repeated trauma over the pinna. We all know in the pinna there is skin and cartilage. There is no subcutaneous tissue, no subcutaneous fat. So skin is directly adherent to the cartilage. So what happens? Sometimes in boxers, or the wrestlers, they will do the repeated traumatic injury over the pinna. So what happens? So there will be skin will be uplifted from the cartilage, and there will be collection of either the blood, some sort of mucus, or some serous collection leading to cauliflower ear. So trauma to pinna without lacerations leading to formation of hematoma. It is also known as boxer ear or wrestler ear. Treatment was a treatment, so we have to aspirate complete fluid, whether there is a blood or there is serous fluid. We will aspirate that, then followed by the pressure dressing with the help of dynoplast, or we can do with the help of plaster of Paris. So aspirate the fluid and then do the pressure dressing. Then there is another term which is known as perichondritis. So what is the perichondritis? It is the infection of the cartilage around the ear. So this is the cartilage around the ear. If there is an infection, so that is known as perichondritis. Most common organism responsible is Pseudomonas aeruginosa. So Pseudomonas aeruginosa, it is the most common bacteria involved. Symptoms are very tender, painful pinna. If you try to touch the pinna, pull the pinna, or do the tragus pushing test, the patient will feel lot of pain which is unbearable. So painful, red hot, stiff pinna which can further lead or convert into the abscess if we will not treat the patient on time. Okay, what is the treatment? Treatment is again systemic antibiotics. Now then there is furunculosis. What is furunculosis? It is a localized infection of the hair follicles which are present in the skin of external auditory canal. We all know external auditory canal, the outer part, it consists of skin filled with hair follicles. Sometimes because of Staphylococcus aureus bacteria, these hair follicles may get infected, leading to furunculosis. Generally, this infection is localized to the cartilaginous part of the external auditory canal. We know external auditory canal, the outer part is cartilaginous and inner part towards the middle ear is the bony part. So furunculosis, this infection is limited to the cartilaginous part, and symptoms are pain and tenderness in the external auditory canal. Patient will not allow to touch any of the relative or parents to his ear or pinna. And the pain will generally aggravated by the jaw movement because that temporomandibular joint is there. If a patient tries to swallow or chew anything, so this pain will get increased. So pain will aggravated by the jaw movement, and so the lesion is very small, but pain as proportion to the lesion is very, very big. What are the treatment? Treatment is anti-staphylococcal antibiotics like the cloxacillin. Then we do the warm compresses. We can pack the ear with a 10% ethymol glycerine that will reduce the swelling. If there is an abscess development, so we will just incise the abscess and drain out the